You know, a lot of times if you ask a patient just in general to raise your legs up from here and hold it there, they can't do it, right? They can't. It's not a very strong area. But you look at what the core does, keeps the lumbar spine in lordosis, in that curve. So you need to also train the anterior aspect of the core to make sure that it keeps its integrity, to support that extension in the back. Because what you're trying to achieve is you're trying to achieve that normal curvature and that extension. But you lose the extension when all these muscles get spasmed, right? So it can be as simple as, you know, you do straight leg raises and people say, oh, straight leg raises, yeah, it does work for this, but you're also engaging the core. So even just having the patient work with them active assistively, get their legs to raise up, one leg at a time if they're really weak, is important. And then obviously if they can't even do that, you get them to start off with the knees bent and you have them just raise, you know, one leg up and down, and then eventually get them to go the other leg and then both. There's different there's different patterns of progression that you can do with it, but it's also important. Obviously, also when you can have them work on eccentrically coming down. So you can help them kind of bring it back up and eccentrically work them down. But the key thing is once you start to engage and loosen up those areas, you know, the extensor muscles that are loose, you need to make sure that these guys in the front are providing stability, so that way instead of having this and creating it again, you're more stable up front and you're getting more of a lumbar spine lordosis.
Yeah, that helps with engaging the core.
Yeah, it makes a big difference. It makes a massive difference because a lot of those muscles are finicky and they're small and they're trying to keep you straight, and you sit a lot. So if you don't have that anterior part of it kind of stabilized, you end up having this problem, you know? And that's where also the hips, like the mediuses and the adductors and so forth, they provide an additional support level for the core. Because if they're also strong and they're firing together and they're not in spasm, then they provide the stability in addition to that, right? So you see a lot of people doing exercises within this range, and you get a lot of overflow to the core, which is great, you know? But so you have to just think about how you're going to progress when you have them prone and you start working on some of that stuff, or sideline when you start working on their stuff, bring them back supine, make sure they get a little bit of that core engagement. It doesn't require a lot, you'll be surprised. Just a few repetitions, not even 2 sets, sometimes just engaging that, it makes a difference in keeping your lumbar spine spasm. If they have spasm, less, right? Remember again, if you do superficial work and you loosen that up, and it's now loose and they stand up, the deep extensors will fire because now the superficial muscles are not firing anymore because they're relaxed, they're not in spasm. So once you remove the spasm out of the superficial muscles, just be careful that the deep ones, they're not strong, they're weak in their spasm, but you haven't gotten to them yet. So you have to keep that in mind. So don't spend all the time in the deep extensor muscles. Go to the hips, go to the glutes, move around, and then again work on getting the stability in the front. And of course, you know, when you start to progress them, they can do side lying, abduction work, seated work, standing, walking, you know, that sort of progression. Good?
Yeah.
Cool.
Good.
All right, guys.